And then also at the same time, Medicaid was signed in, which is basically health insurance for poor people, if you will. So that's where we are today. The cost of healthcare across the country is roughly 17% of the GDP. One in every $5 spent today is going towards the cost of healthcare. It's a problem. Factors that are increasing the cost is the aging population, right? The rise of chronic conditions, people get sick, advances in medicine and technologies, and interestingly enough, I would have never thought this one, but you see a lot of hospital market consolidations, and it was actually an article a couple of weeks ago in Newsday. But you would think that if there's going to be hospital consolidations, the price of services should be coming down. The cost has gone up due to these acquisitions, mergers and acquisitions. In addition, the underlying cost of healthcare services, lack of price negotiations, high provider salaries as compared to other countries, arbitrary pricing, high cost of drugs, under the drugs, unregulated drug problem, pricing, expensive patient protection, right? That's what's driving our cost up as a country. Roughly 69% of the population is 54 years or younger, accounting for 44% of the total spend. Those that are 55 or over, 31% account for 56%, which makes sense. The older you get, the more things you're going to have. People under age 35 comprise of 44% of the population, only 21% of the spending. It all makes sense. The older you get, the more spend you're going to have, because the more likelihood of getting sick or getting disease is what's going to happen. Okay? Out-of-pocket spending. The top 1% spending averaged about $24,000 out-of-pocket expenses. Top 10% spent roughly $6,200. The bottom 50% spent about $358. So I'm sharing this with you because at the end of the day, when we're looking at how to structure different models for different employers, you want to keep these factors in mind with respect to the different, I'm going to call it insurance tools that are available to you to try to maximize the benefits to the employees, but also minimize the cost to the employers. That's the reason I wanted to share those particular facts. Now, interestingly enough, half of adults say it's difficult to afford healthcare costs. Agreed? 1 in 4 report putting off healthcare because of cost, because of the out-of-pocket they're going to have, not necessarily the premiums, because of the out-of-pocket. 6 in 10 uninsured adults say they have skipped or postponed getting healthcare they need in the past 12 months due to the cost. 4 in 10 currently have debt due to medical or dental bills. And that's even while being insured, which is still a staggering number. Then, so we spoke about the introduction. All right, so roughly 65-35 is where we are today, 65% private, 35% government, between Medicare and Medicaid, right? Then what had happened is in March 2010, we did the Affordable Care Act, remember Obamacare? Right. Now, New York itself, before we get into Obamacare, was a pretty progressive state itself, meaning the state had protections for their residents, if you will, and people covered in their insurance plans more so than any other states. Okay, so what got passed in the Affordable Care Act, that much of the effect was really in 2014, but it was passed in 2010. It took time to get through. But this is a big one: prohibition against pre-existing conditions. Yeah. Right, you hear that now. But I will share with you, before this happened, we had groups in New Jersey and Kentucky. And in Kentucky, we wrote the insurance out of Kentucky because they had less state regulations, less state requirements. And interestingly enough, one of the employees, who was a relatively new hire, he wasn't on the plan for 12 months because normally the pre-existing condition rule was 12 months. If something happened in 12 months, he's not going to be covered as a result of a particular condition. Poor guy had a heart attack and he had heart problems. He was in the hospital, the insurance company denied him. So that was a real thing at that time. Now, had it been written in New York, it wouldn't have applied because New York had pre-existing conditions way before the Affordable Care Act came into being. But that was a big thing. Big thing. And now at least today, if switching from one plan to another, that's the current concern that you don't have to worry about anymore. And we still get those questions today. Hey, do I have to worry about pre-existing conditions? No, you don't have to worry about that anymore. Right? Then number 2, lifetime limits. Take a look at your health plan right now. Now the benefits are unlimited prior to the Affordable Care Act, and we used to provide these. A lot of the lower income employees, I'm going to call it the working poor, employers would provide this limited medical benefit program. Maybe the maximum benefit might have been only $25,000 or $58,000, but most of the time the cost or the expected claims were going to be significantly less than that anyway. So most of the time it worked. However, due to the passage of the Affordable Care Act, those plans went away, so it became a little bit more difficult, for these working poor. And I'll get into that in a moment, speaking about some of the other requirements. Okay, you'll also notice, and I'm experiencing this right now, that kids are covered up to the age 26. And then the other point that the Affordable Care brought in, which I think is pretty important, very important, is annual preventative exams are covered at 100%. And that's irrespective. We're going to talk about plans a little bit later, but irrespective of the plan that you're on, the annual preventatives are always free. Now you have to be careful, because when you go to the doctor's office, they're going to say, well, you owe me a copay. Well, technically you don't. Well, the other thing is this. When I go for my annual preventative, they say, oh, Johnny, this is what you get for your annual preventative. But for another $100, you get have your EKG, and you can have this, and you can have that. So they always find other ways to increase their revenue, but that's what they do, right?
Right.
Okay. Then also, as a result of the Affordable Care Act, was the establishment of the healthcare exchanges. And I'm speaking specifically about New York right now. But in New York, prior to the healthcare reform, getting individual coverage, the cost was obscene. Single coverage was running maybe $2,000 a month. It was crazy. So in New York, the Affordable Care Act, the healthcare exchange, was a big thing, because now it brought it down to be somewhat reasonable for individual coverage.
It's really not cheap.
It's not.
Cheap, but it's not what it was.
Cobra is a fortune too.
Right.
If you lose your job.
Yeah,
$1,300 a month for a single is not cheap.
I'm not disagreeing with you, but it's better than $2,000, right? So at the same time, what they did, part of the Affordable Care Act, they said, okay, based upon your income, you may be eligible for premium subsidy. So originally it was up to 400% of the medical the poverty level. If you were earning up to 400, you were able to get a premium subsidy for what was known as a silver plan through the exchange. So there's some lower income. We're talking about the working poor, if you will. They were able to get on health insurance or individual coverage for relatively little or no cost, which was big. It's a big deal.